Hello everyone and welcome to today's lecture on the navicular bone. It's a component of the human feet. In this session we will cover its detailed anatomy, articulations, muscles and ligament attachments, ossification centers, clinical correlations and its role in maintaining foot stability and mobility. So come and let's get started. The navicular bone is a small but vital component of the human body. It's located on the medial aspect of the teres. It is shaped like a small boat. Hence its name when comes from the Latin word called navicula, means little boat. The navicular lies between the talus posteriorly and three cuneiform bones anteriorly, forming an important bridge between the hindfoot and the midfoot. This unique position enables it to transfer body weight from the talus to the cuneiform and further to the metatarsals, which is essential for standing and walking. It also forms a major part of the medial longitudinal arch of the foot, which provide it both flexibility and support, and that allow the foot to adapt to various surfaces while also maintaining stability. In addition to its structural role, the navicular serve as an attachment site for key ligaments and tibialis posterior tendon, which further enhances the arch strength and function. Due to its critical role in biomechanics, it is also prone to certain clinical conditions such as navicular stress fracture, accessory navicular syndrome, Kohler disease, which we will discuss later in this our session. The navicular bone is defined as an irregularly shaped bone, short boat-like tarsal bone of the foot. It is situated onto the medial aspect of the midfoot, where it forms a crucial link between the hindfoot and the forefoot. Posteriorly, it articulates with the head of talus, while anteriorly it articulates with the three cuneiform bones. In some cases, it also have a small articulation with the lateral side of the cuboid bones. Here is the structure where this form the joints. The navicular sits just above the sustentaculum tali of the calcaneus, and it helping from the upper part of the medial longitudinal arch. One of its important landmark is the navicular tuberosity, a bony prominence that can find on the medial surface or the medial side of the foot, and it is easily palpable beneath the skin. This tuberosity also serves as the insertion point for the tibialis posterior tendon, and the position of the navicular is central to the structural integrity of the foot, as it transmits force from the talus to the forefoot and enable efficient working and running. This slide describes the shape and anatomical features of the navicular bone, including its surfaces and landmark. So, the navicular is a boat shaped. The navicular is the boat shaped irregular short bone which contribute to its name and function. It has been a 6 distinct surfaces, each with specific anatomical and functional feature. Starting from the dorsal side or the upper surfaces, it is convex and rough, providing attachment for ligament. So on the dorsal side, it provides attachment for the ligaments. On the plantar surfaces or the inferior surfaces, it is concave, also rough, and serve as an attachment area for the spring ligament, which supported the medial arch. On the medial surfaces, it has the prominent navicular tuberosity, which can be felt under on the inner side of the foot. This tuberosity is the insertion point of the tibialis posterior tendon and serve as a key anatomical landmark. The lateral surfaces, it is smaller and sometimes articulate with the cuboid bone in some individuals. The posterior surfaces has a concave facet for articulation with the head of the talus and form part of the talonavicular joint. The anterior surfaces, it is convex and divided into three facets which articulate with the three cuneiform bones. And these features allows the navicular to support the arch of the foot and serve as a point of attachment for ligament and tendon and enable efficient force transmissions during walking and running. Let's now look at the articulation of the navicular bone and understand how it's connected with the other bones. So, the navicular bones articulate with the totals of 5 bones. Navicular bone, this one is the navicular bones and it articulate with the 5 bones. And sometimes in some individual it can articulate with the 6. Posteriorly, it articulate with the head of the talus to form talonavicular joint, which is a ball and socket type of synovial joint, and this joint plays a crucial role in allowing the medial arch of the foot to adjust on the uneven surfaces. On the anterior side, the navicular articulate with the 3 cuneiforms. The first one, second one and the third one. The navicular articulate with the 3 cuneiform bones, medial cuneiform, intermediate cuneiform and the lateral cuneiform through these 3 separate facets on its anterior surfaces. On its lateral side, in some individual it may also articulate with the cuboid bone, though its articulation is not always present. These articulations are collectively part of the midfoot and contribute to the transverse tarsal joint, which also include the calcaneo-cuboid joints, and the transverse tarsal joints allows the forefoot to rotate relative to the hindfoot, enabling the foot to adapt to different terrains while maintaining balance. Overall, the navicular articulations are essential for both flexibility and stability of the foot during walking, running and jumping. Now we will discuss about the muscle and ligament attachment on the navicular bone and how they are contributing to the foot stability. So the most important muscle attachment on the navicular bone is the tendon of the tibialis posterior. Tibialis posterior tendon. This tendon inserts on the navicular tuberosity located on the medial surface of the bone and plays a key role in supporting and elevating the medial longitudinal arch of the foot. When the tibialis posterior contract, it helps in inversion of the foot and provides dynamic support to the arches, preventing flat foot deformity. On the plantar surface, of the navicular, the plantar calcaneo-navicular ligament, that is commonly known as the spring ligament, attaches between the sustentaculum tali of the calcaneus and the navicular, and these ligaments form a sling for the head of the talus, maintaining the medial arch and preventing collapses. Additionally, the dorsal and plantar surface of the navicular also serve as an attachment point for various dorsal and plantar tarsal ligaments that stabilizes the midfoot joints. These muscles and ligaments attachment together ensure that the navicular provide both mobility and stability of the foot, and it allowing it to adapt and different surfaces while bearing body weight efficiently. Now understand how the blood supply and the ossifications of the navicular bone, which are important for both development and clinical conditions. So The navicular bone receives its blood supply from small branches of both the dorsalis pedis artery and the posterior tibialis arteries. However, the central portion of the bone has relatively poor vascularity compared to its periphery. This limited blood supply to the central area makes the navicular particularly susceptible to avascular necrosis or delayed healing in the event of injury, such as stress fracture. Regarding ossifications, the navicular is notable for being the last of the tarsal bone to ossify. The primary ossification center of the navicular usually appears around the 3rd year of life. In some children, delayed ossifications can sometimes be mistaken for pathology on X-ray, but it's generally a normal variant unless associated with pain or other symptoms. Understanding the blood supply and ossifications is clinically significant, especially in conditions like Kohler disease, which is an avascular necrosis of the navicular seen in young children. Let's first talk about the navicular stretch fractures, which are common in active individuals. Navicular stress fracture occurs due to repetitive stress and overloading on the midfoot, commonly seen in athletes, dancers, and military personnel. Patients usually complain of pain localized to the dorsal and medial aspect of the midfoot, which worsen with activity and improve with rest. On examination, there is tenderness over the navicular bone, and diagnosis confirmed with imaging such as MRI or CT scan, as plain X-ray may miss early fractures. Treatment often involves non-weight bearing immobilization in a cast for several weeks. In severe or non-healing cases, surgical fixation may be required to restore the integrity of the bone and prevent long-term complications. Next, let's discuss the accessory navicular bone and anatomical variant that can sometimes become symptomatic. The accessory navicular bone in an extra ossicle located medial to the navicular tuberosity. It is present in approximately 10 to 12% of population and is easily or generally asymptomatic, discovered incidentally on X-rays. However, in some individuals it becomes painful, especially when wearing tight or ill-fitting shoes or during activities that place excessive stress on the medial arch. This condition is known as the accessory navicular syndrome, and patients present with pain, tenderness, and sometimes a visible bump over the medial side of the foot. Management is usually conservative, including footwear modifications, arch supporters, and physical therapy. In resistant cases where symptoms persist, surgical excisions of the accessory bone may be performed to relieve pain and restore the functions. Now let's talk about the Kohler diseases, which is a rare condition seen in children. Kohler disease is an uncommon condition characterized by avascular necrosis of the navicular bone in young children. It typically affects boys more than girls and is most commonly seen between the ages of 4 and 7 years. The exact cause is thought to be a temporary disruption of the blood supply of the navicular and leading to bone ischemia and necrosis. Clinically, the child presents with pain and swelling over the medial aspect of the midfoot, often accompanied by a limp or refusal to bear weight. On examination, there is localized tenderness over the navicular bone, and radiograph may show flattening, sclerosis, or fragmentation of the navicular. Fortunately, Kohler disease is self-limiting and usually resolves over several months with conservative treatments such as rest, reduced weight bearing, and sometimes casting to relieve symptoms and allow healings. Finally, let's understand how tibialis posterior dysfunction can lead to flat foot deformity involving the navicular bone. The tibialis posterior muscles plays a crucial role in supporting the medial longitudinal arch of the foot. Its tendon insert into the navicular tuberosity and when functioning properly helps invent and stabilize the foot during gait. In some adults, due to overuse, degeneration or injury, the tibialis posterior tendon become inflamed or ruptured, leading to what is known as tibialis posterior dysfunction. When this happens, the navicular bone is no longer adequately supported and the medial arches collapse, resulting in an acquired flat foot deformity. Patients often present with the pain and swelling along the course of the tendon, especially on the medial ankle and foot, along with the valgus deformity where the heel rolls outward. Management depends on severity and ranges from orthotics and physical therapy to surgical repairs or reconstructions in advanced cases. Recognizing the relationship between the tibialis posterior tendon and the navicular bone is key to understand the pathogenesis and treatment of the adult acquired flat foot. Let's summarize everything that we have discussed about the navicular bone. To summarize the navicular bone, it is a boat-shaped irregular tarsal bone located on the medial side of the foot. It serves as a vital link between the hind foot and the midfoot and transmitting weight and maintaining the integrity of the medial longitudinal arch. Its key anatomical features including the prominent navicular tuberosity which serve as an attachment point for the tibialis posterior tendon and it articulates with the talus, cuneiform and occasionally of the cuboid bones. The navicular also support important ligaments like the spring ligaments contributing to the stability of the arch. It is last tarsal bone to ossify and has a relatively poor blood supply, making it prone to certain clinical conditions such as stretch fracture, accessory navicular syndrome, Kohler disease and flat foot due to tibialis posterior dysfunction. A thorough understanding of the navicular anatomy, attachment, ossifications and clinical relevance is crucial for diagnosing and managing midfoot disorder effectively. Thank you for attention. So if you like this lecture and you want to learn more, so please like, subscribe and share our channel Charming Science. Thank you very much.